Electronic medical records, to some degree, has become a way of life for most healthcare providers across the country. With government-supported initiatives, implementation of electronic records is now present in many physician offices, hospitals, and across numerous health systems. The vendors and back-end databases that support these electronic medical records vary, and we are still dealing with issues of connecting all the patient information between systems and between institutions or offices. This push for interoperability needs to be addressed, but in addition, the data that's being stored needs to become more actionable and presented in a proactive manner so that we can impact patient risk and quality of care delivered across the care continuum. To address some of these issues and present a solution to delivery of actionable information across the care continuum, we'll use a case study of a not infrequently encountered problem in a hospital. The case study is going to demonstrate the flow of patient care across the continuum and involving multiple care team members. A 48-year-old gentleman with a past medical history significant for tobacco use and some unknown cardiac intervention performed at a different healthcare institution than the one the patient arrived at with an acute medical problem. He sustained a trauma where he fell getting out of his car, resulting in striking his head on the concrete. The only thing he could relay to the emergency room physician was that he was taking Plavix and had some sort of intervention done to his heart a few months back, but really wasn't able to provide any more details or specifications about what happened. He was assessed in the emergency department, obtained a head CT, which showed an intracranial hemorrhage, necessitating the need for surgical decompression of this hemorrhage. We had a continuum problem now. The patients in the emergency department needs to have a surgical intervention and will need post-operative care and monitoring to make sure that the surgical intervention was successful and no further complications or neurologic decline occurs. But currently, we have a patient at the center of all of our attention and focus, and we have numerous providers that are going to be addressing this patient's care from the emergency department through the operating room period and into his post-operative period in the intensive care unit. We have many players and many services in the hospital that are involved in the care of this patient. First and foremost, we have a surgeon who performed the evaluation in the emergency department and was concerned that there was issues with anticoagulation in this patient. In addition, we had issues with his heart status, where cardiology and an outside institution performed some sort of intervention. And finally, we have a lab that's involved with collecting and performing tests on this patient's blood in order to provide the surgeon and the anesthesiology team with more information on the needs this patient will have during an operation to decompress the bleeding around his brain. The anesthesiologist is concerned with optimizing this patient, optimizing their current medical issues, and getting a better understanding of what risks lie ahead for this patient with respects to general anesthesia. And this needs to be done in a timely and coordinated fashion so that we can limit any neurologic injury from the trauma this patient sustained. In addition, the anesthesiologist has to help coordinate resources in the operating room, predict delays, and assess and deal with this patient on the most timely manner that they can. But they're dependent on numerous other institutions and services, such as the lab tests being done, completed in a timely manner, and obtaining medical records of what interventions were done at an outside institution and what cardiology concerns remain about this patient and the stress he's about to undergo with surgical decompression of his brain and a general anesthetic. So we have multiple players all surrounding a patient, leading to numerous challenges to do what's right for this patient. There are many unknown questions that are acute in nature and require timely intervention to make sure we develop and deliver the optimal care to this patient. With electronic medical records, we have additional barriers and constraints that we have to navigate. One is different systems at different institutions where patients' medical information is stored and needs to be accessed by the surgeon, the anesthesiology care delivery team, and an open communication with cardiology either at the institution where the patient is admitted or at the prior institution to gain additional information about the risks from a cardiac standpoint and why this patient was on Plavix following some cardiac procedure. So this case presents a number of different challenges that we can group into 4 blocks. The first is medical information flow, or obtaining the information about this patient's prior history, as well as incorporating new information that we gather from evaluations, consultations, or laboratory tests as we prepare this person to undergo surgery and have an uneventful postoperative course. When the information is being generated, we also need to notify numerous players on this care team. We have both direct anesthesiology and surgical concerns about the elevated potential for losing blood in the operating room with an elevated level of anticoagulations on board in this patient. But in addition, we have cardiologists who may want the patient's blood more thin because of a recent cardiac intervention and possible placement of a stent, placing him at higher risks for a postoperative myocardial infarction if his anticoagulation is completely corrected. So we've got an issue with collaboration between the direct players, the anesthesiologist, the surgeon, and the patient, but also indirectly with patient care following the surgery and leading up to the surgery. Additional care in the emergency department needs to be collaborated on, as well as postoperative recovery care in the intensive care unit between the nurses and other healthcare providers that will be intervening to help give this patient a risk-free and safe course. Finally, we need a way to automate all of this workflow so that those parts that can be addressed and taken care of on an automatic nature are done so, and that everybody on the team is on the same page with the information that's shared with any one of the team members. The medical records are used to gather a great deal of patient data, but they're also used to communicate information and challenges to other providers across the care continuum. The problem is a lot of this information that's communicated in the medical record is buried in notes or may not be very clear or easily missed by other providers. So what if we could address all of these challenges and have a care solution that incorporates the electronic medical record, irrespective of where the information is contained in that medical record, or from medical records that are located in different physical locations at different institutions or at different physician offices. In addition, what if we could notify the direct players that are involved with care, keeping them abreast on the status and new changes that are uncovered as we get information and as the patient progresses along the care continuum? How do we bring together these resources and allow for collaborative care, something that is present in our system currently, and we depend on multiple providers, either across shifts or across disciplines, to take care of our patients and manage them so that they can have great care, high quality care that's cost effective by eliminating duplications and providing resources where they're needed and when they're needed. So what if we had patient medical information flow that came into a system from multiple divergent sources, different EMRs, different health information databases within a single institution, or even within a single institution, but from different parts of the institution, such as an outpatient source and an inpatient medical record. What if we could gather all the medical information and present that in a unified framework that physicians and other care providers are familiar with, provide them with updates, real-time displays that decrease the amount of searching and jumping through different systems or different screens to try to gather and put together the entire care picture and the disease picture so that we can intervene and are less likely to have errors from missed information or duplication of tests and services, again, because of not knowing if something has been done by a different provider or if the appropriate documentation is contained within that system. What if we could link information from an inpatient record and an outpatient record that is easily accessible by the care providers at the point of care when the care is being delivered and in a timely manner, irrespective of where that data is stored and which electronic medical record system has to be accessed? This is possible using a framework that Zoeticx has developed, a middleware platform that integrates with different health information databases and is able to provide information either within a single hospital system that uses two separate EMRs for inpatient and outpatient care, or between healthcare systems, leaving consistent the interface and the way you interact with the information to take the data and convert it into information that can be used for patient care. So we can have a medical information flow that is both consistent with how healthcare providers deal with all the information that patients generate and are not concerned about how it is stored or where they can find it in an EMR system that may vary between vendors or even within different specialties. Once we understand the patient information flow and can access that in a way that is consistent with patient care and the healthcare workflow, we have more abilities to take care of more complex patients in an efficient manner while reducing risks across the board from duplications and missing critical pieces of information. In addition to the medical flow, something that's equally important is target notification. Currently, we are in an era where we're seeking information and we have to search for it. As a physician and care provider, I am constantly searching the electronic medical record in different areas to try to put together a complete picture of my patients so that my interventions or additional studies are commensurate with quality care, depending on how the patient presents or who's involved with that patient's care. But there's not currently a way to push that information not only to myself, but across the care continuum as we collaborate with different care providers, be them nurses, other physicians, or even outside consultants that have valuable information to share on that patient. Well, if we had the ability to set patient medical conditions and alerts on a user-by-user basis, it would then allow us to change who's involved with that patient's care, whether they're off on a different shift or they've just came into the care as a specialist or some other care provider. If they are notified of the information, like in our case here, when that blood test comes back, instead of me having to constantly search for that blood test and wait for it to be updated in the system, if I got a target notification on that patient of what the level was, I could then immediately distribute information to the operating room to proceed and bring the patient to the OR if the value is commensurate with proceeding with the surgery, or I could immediately institute a second phase of treatment, the ordering of blood products to treat the elevated coagulation profile in this patient because of his taking of Plavix. So Zoeticx also not only allows for data flow, but also allows for target notification so that everybody that's involved with that care, everybody that's subscribed to that patient's care, will be notified of the information they need to know to continue their workflow and take care of this patient. In addition, these target notifications allow for us to prepare or to sequence care across the continuum. As pieces of information come in, we can then make further decisions, and all these alerts and push notifications can be customized so that if you're peripherally involved in the care and you really don't need to know about what the coagulation profile is on this patient in the middle of the night when he arrived for his surgery, you don't need to be notified for that. There's also the ability to escalate that care, that when the notifications are sent out and abnormal values are sent out, if they're not addressed, that care can be escalated to somebody else on the care team, again, so that we know things are not being missed. One of the most important things is when somebody intervenes with an abnormal value, that notification or that intervention is also pushed out and notified to everybody else on the care team so that they know it has been addressed. If the coagulation factor is too low and everybody on the team knows that, and the surgeon next wants to proceed with preparing blood products for this patient to be administered before he goes to the operating room, everybody will know, and there won't be multiple calls or multiple pages between each of the care providers to update that on what's the status. Everybody will know that subscribed to the patient what's going on and what's the next phase of care. Again, an important tool to help optimize our use of patient information, even across different databases or different electronic medical records. So these two parts of the Zoeticx platform are critical for the phases of care that we are in now, and that is the ability to collaborate with multiple healthcare providers, as well as to consult so that we can break some of the barriers to communication in our current system. Because again, our electronic medical records are being used to not only store patient information, but also as collaborative and communication tools. But we don't often look at them as a way to communicate other than by drafting a note. We don't know if another collaborator or consultant has picked up on our concerns. Well, with the ability for a patient dashboard and when a concern arises, to be able to send that moment in time of patient care, the vitals, the hemodynamics, potentially lab values that are abnormal, at that point in time to be able to provide a consultation request to another physician, they then will see what I was seeing and what raised my concern, allowing them to have up-to-date, actionable information that they can respond back to me saying, no, that's not a concern for that specialty, or yes, we need to address this immediately and this is how we want to proceed. So by having a platform that allows for collaboration and consultation, we have up-to-date patient medical information, again, that can arise from different EMR sources, consolidated into a single view that we can now use as a tool for communication and a tool to support collaboration and consultation. So what if we have the ability then to not only coordinate, but also to track and notify patients among care providers? Now we have the ability to make sure that information that is generated, information that is critical to patient care, that is critical to reduction of errors and providing high quality, cost-effective care is available, not only at one point in time, but across the entire care continuum, irrespective of the number of people that are involved in that care. Now we have a tool that allows us to communicate, collaborate, and to actively take care of patients when their data is being generated, as opposed to having to seek out all that information at different discrete points in time. Now we have a continual, dynamic, collaborative platform that allows us to manage patients' care in a manner that's consistent with how our health system has evolved. We have the ability now for everybody on the care team to see the status of labs that were pending and to notify others for resources that will be needed or when we will proceed with the surgery. So for instance, if we look at the case that we demonstrated earlier, when this patient's lab values come back and his coagulation pattern comes back, we'll all know whether it's okay to proceed with surgery or if additional tests need to be done and when we will need to mobilize the resources in the operating room. It gives us a platform now to connect multiple people together, including cardiologists that may not be directly involved with this patient's care, yet it allows us to communicate information provided our concerns along with patient data to those consultants to try to get back information as in a quick, effective, and collaborative way so that we don't have a single physician ordering a lab test and that physician is notified or that physician is required to check back on that lab test and then coordinate or communicate that information with multiple people on the team. Instead, now we have a way to push notify people on dynamic data that's going to impact the care that we deliver. This allows for us to escalate alerts, to provide to-do or medical activity tracking to remind care providers of outstanding pending tasks that need to be addressed or need to be followed up on once the result comes back to change the course of care for that patient. And to track all this and to record all this stuff in real time, communicating back to the electronic medical records, we now have an actionable and accountable framework for care across the continuum. Not only that, we have a way to go back and look at this from an administrative and a quality standpoint of what information was collected, who was notified about that information, and how was that information acted on in a timely, effective, and consistent manner so that we can look at system level thinking now and coordinate our activities better and possibly even divert care to different providers depending on what cases they're currently involved at and what acuity level that is and what information out there is pending and needs to be addressed in a timely and effective manner. This platform is developed and it's Patient Clarity Healthcare Collaborative Platform, which allows for the interaction and collection of data without duplication of data, but instead provides an interface to the back-end databases that power many of the electronic medical records that currently are present. The ability to map this then allows us to provide a consistent front-end presentation, as well as to develop tools and logic on top of that to target clinicians, healthcare providers across the care continuum, be that at an acute level or later on planning for discharge, continuity of care throughout, making sure things don't get missed with watch lists and alerts and to-do lists for patients that don't exist right now in many of these electronic health platforms. And to provide all this on mobile platforms as well as desktop platforms so that the care can be accessed and impacted no matter where these physicians and other providers are. The platform is deployed on a cloud infrastructure and allows for further development for customized solutions, be it on the interface side or on the data that's being presented for different physicians or different providers that have different requirements for all the patient data that's being generated. Having a consistent display of information allows for a reliable platform so that information is not lost or missed when a physician or a nurse searches for information that she can't find where it would typically be. Having a consistent interface allows for optimizing care and reducing errors. So this platform provides a number of benefits. Care providers are allowed to build teams that are all in alignment, knowing that when some member of the team interacts with a patient, impacts a treatment, finds a new finding, or orders a new lab, we know who has ordered, but also who is accountable and who's going to follow up on that. If that care team member is not available at the time and somebody else on the team picks up the abnormal lab and addresses it, everybody across the team knows in a consistent manner, so there's not redundancy of care. This can then stretch across the continuum as patients migrate through the system from an emergency room to an operating room to an ICU to a floor to a long-term care provider all the way back to home and to their primary care provider. We can manage it across that care continuum and provide providers at each one of those steps with the information that they need to see what care was delivered and what additional items need to be addressed and followed up at to make sure we don't have hospital readmissions or complications that develop because the care continuum had changed a physical location. So the ability to flow data across the care to provide target notifications and push notifications to providers that are directly involved with caring for that patient, as well as providers that are peripherally involved with caring for that patient, like a primary care physician that wants to follow the care course throughout the hospital but aren't directly involved with that patient's care while they're in the hospital. They might be able to provide valuable information to the physicians and the nurses that are taking care of the patient, even though they're not involved in just following along peripherally. This allows for productivity enhancement, and it allows for expanding our current care model to keep everybody aligned and to improve the communication across multiple channels. In addition, administration sees a fair number of benefits from a platform such as this. Most high on the list and very high from JCAHO and other regulatory bodies is the ability for quality care in a safe and effective manner so that we can efficiently deliver health care, we can reduce redundancies of healthcare delivery, and more importantly, we can provide quality metrics along the line, along this entire care continuum, and make sure that information is not being missed or overlooked because it was lost in the electronic medical record. It also allows for operational efficiency and diverting patient care to different providers or understanding the loads that providers are under at different points in time, depending on what items are still outstanding or what information or patient volume is present for a given provider. It also allows for secure communication and collaboration between providers so that we don't have to use multiple systems and piece together multiple systems one to deal with text messaging, one to deal with phone messaging, one to deal with paging communication, one to deal with notes and documentations that may be placed in a part of the record that other people on the team don't see or are not used to accessing. Again, a lot of things in the platform allow us to tie together numerous areas and numerous dependencies, but most importantly from an administrative standpoint are the ability to deliver high quality, effective, efficient care and to capitalize on the current electronic record systems that they have in place to obtain a better return on investment. Instead of ripping out the systems they have in place and replacing them with something that provides a different level of functionality, we have the ability now to use the data that's contained in these electronic medical records to integrate them between different systems to allow for interoperability of the information off of that data that's stored, and to do so in a consistent and expandable way where one can develop tools on top of this platform that are for specific area or niche parts of healthcare. We're excited that Zoeticx platform provides a lot of the missing pieces to EMR interoperability and addresses issues with collaboration, communication, and importantly, does so across the entire patient care continuum. For more information or to set up a custom demonstration of the platform to see if this can meet your needs, please contact Zoeticx.